Hey there, Dr. Alan Christianson here with you. I want to talk about what to do about fear and anxiety from Graves' disease. So you still have to treat Graves' disease. We've got to manage it and we've got to reverse it. But the process of treating Graves' disease, even if it's radioablation or surgery, it just takes time for those extrathyroid hormones to clear out of your body. In all cases, it takes a little time. The best treatments involve blocking the iodine uptake by the thyroid, and we'll talk about natural things that do that. But it does take about 4 to 6 weeks for the iodine that's already in the gland to get used up. So during that time, we've got to manage the symptoms, especially those acute anxiety symptoms. And there are natural options and prescription medications. The prescriptions have some baggage. So the main ones used there would be benzodiazepines or beta blockers. The benzodiazepines, that's medications like Ativan or Xanax or older ones like Valium. And no debate, they do a good job to stop anxiety. But the drawback is when they leave your body, you're more anxious than you were before you took the pill. So they have rebound side effects. Let me make up some numbers to illustrate his point. Let's say that anxiety is 0 through 10. And let's say you're clipping along at an 8 and you're not feeling well. So you take an Ativan, and within about 60 minutes, maybe you're down to a 4 or a 3. Cool. But about 6 hours later, remember you were at an 8 going into this? You're going to be at a 9 or a 10. And you're going to really reach for some more Ativan quickly. Now let's say your Graves' disease is completely controlled and no longer an issue. Guess what? Even with that, that Ativan leaving your body will make you more anxious than you would have been by yourself. So the pitfall is they are habit forming. And the other pitfall is that they create structural, visible brain damage. They rot out parts of your brain. No exaggeration. There are findings visible on SPECT scans that can demonstrate that. So good to not get stuck on that pathway. Beta blockers are also used. That's medications that are slowing and stabilizing the heart rate. Atenolol is one of the main ones there. And these can help to lower some of the anxiety symptoms. They're gentler than beta blockers, both in terms of danger, also in terms of efficacy. They're not as quick acting. They do tend to worsen fatigue symptoms. So that's the trade-off with them. In terms of natural options, a couple of big thoughts. First one is really avoiding caffeine, because I've mentioned this, that even if the caffeine wouldn't affect you by itself, in the state of Graves, it's so much more powerful. So skipping all the stimulants is an easy way to not feel overstimulated. Breath therapy is actually very powerful. And there's a simple technique I'll teach you called delayed progressive respiration. So with this, you want to sit down, be comfortable, have your back straight, and be in a situation to where you can see a second hand or a timer that's displaying digital progression of seconds. And the game is nothing more than breathing in and breathing out and gradually letting there be more time lapse between those steps. So you might start with about, say, 4 seconds each. So in on 4 seconds, out on 4 seconds. Do half a dozen of those. And then try for 5 seconds on the inhalation. 3, 4, 5. Still 1, 2, 3, 4 for the exhalation. And once that gets really smooth, add 5 seconds on the exhalation. But spend even 5 minutes going through progressively slowing the breath, and you can have a huge effect managing anxiety symptoms in the moment and completely safely without side effects. A cool trick you can do too is that if you're in the public, you can always just feel your heart rate and just time the breath in your heart. You can be totally inconspicuous and you can just breathe in for 3-4 heartbeats and breathe out for 4 heartbeats. And just watch that and add an extra beat in. And no one has to be the wiser. But in a moment, you can completely reverse many panic and anxiety symptoms from that. There are some great supplements that are also helpful that I'll mention. Magnesium is huge. So for many reasons, it's relevant. Graves' disease makes your body lose magnesium more quickly. So you literally pee it out too fast. And papers have shown that now the majority, 70% of American adults, when they undergo thorough testing, they are magnesium deficient. And the signs of magnesium deficiency include anxiety, tremor, muscle cramps, panic, all these exact things. And you lose it faster with Graves', and you need more of it with Graves'. So it's a matter of just building up something your body actually depends upon. Along the same lines, calcium is also relevant. And Graves', there's also a higher need for calcium because bone tissue turns over more quickly. And also calcium acts as a gentle, natural sedative. It slows the conduction of nerve impulses, so it's sedating, it's calming, and that counters many of these issues. Valerian's a nice option. Valerian's a plant option. It's called Valeriana officinalis, and it's been well studied to be as effective as the benzodiazepines, but without the negative sedation and without the addictive properties. Readily found, non-prescription. Doses of concentrated extracts range from about 50 to 200 milligrams, and no big drawbacks. Most people can do valerian and use it effectively even in the daytime and function well and not be too groggy, but some prefer it just in the evening. They could feel a little bit slow in the daytime. So great natural options to manage the anxiety. Dr. Christianson here with you. Take great care. We'll talk again really soon. Bye-bye.